Hi, I'm Dr. Casey Holland, a naturopathic physician that focuses on complex chronic illness, Epstein-Barr virus, stealth infections, and root cause medicine. Today on the show, we're going to be talking about what actually triggers Epstein-Barr virus to go from being in an inactive state to an active state. If you have not listened to one of our episodes before, I highly recommend listening to our previous ones that describe more about Epstein-Barr virus, what kind of virus it is, and why it does this inactive to active state. Epstein-Barr virus is commonly known as mononucleosis, and most of you have been in contact with it. It's estimated that greater than 95% of people become infected at one point or another. And what we are talking about is how Epstein-Barr virus can be associated with chronic symptoms like fatigue, malaise, and more systemic systems as well. It is associated with 7 autoimmune conditions and many cancers. I often get asked the question, did Epstein-Barr virus cause my autoimmune condition? Did I have my autoimmune condition first? And due to the way that testing works, we might not know when your viral load actually increased or when that Epstein-Barr virus went from an active state, or what you'll hear doctors and scientists refer to as a latent state to a lytic cycle. And that's what we're going to dive into today, is what causes that trigger for it to go from being inactive to replicating active cycle. And I'm going to talk a lot about oxidative stress. This is one thing that I find when working with patients that is not addressed. And so oftentimes I'll have patients that come to me and they say, I've done thousands of dollars in IV therapies. I've done every antiviral herb you can think of. I've tried pharmaceuticals and I'm still not better. And this is the piece of the puzzle that is often missing, is how oxidative stress is being addressed. So first off, what is oxidative stress? Oxidative stress is defined as a disturbance in the balance between the production of reactive oxygen species, or free radicals, and antioxidant defenses. So, what are reactive oxygen species? So these guys go around and cause problems, and your body has to clean them up. And antioxidants help do that. So when we have too much of cleanup happening, not enough antioxidants to fuel that, then we have this increase in oxidative stress, and we term it oxidative stress. Now, what causes these reactive oxygen species or free radicals, and where do they come from? The problem here is, this is where it gets tricky, is a lot of things can cause oxidative stress. Mental emotional stress can cause changes on that level, where we are seeing increases in free radical production and then be compromised with our antioxidant defenses. Environmental toxins, glyphosate, pesticides, if you think of your cleaning products, a lot of those chemicals in there can create reactive oxygen species response, because our body has to clean up and clear them out. Volatile organic compounds, mold and mycotoxins, heavy metals, the standard American diet. If you're eating fast food that's packaged a lot, there's just a lot more chemicals and things involved in that. So even that can be a source of increasing oxidative stress. Intestinal permeability, commonly known as leaky gut. This is something that's really common, where from eating the standard American diet, being put on antibiotics, other things throughout life, stress, your gastrointestinal tract, which commonly is like very tight together, gets loose, and we have these holes in it where we're mounting an immune response to things that we shouldn't be. And this can be a source of oxidative stress. Parasites, Lyme disease, other chronic infections, other medications. Sometimes the medications that you're taking might also be creating more stress in other areas of your body. And COVID, that has been a big source of oxidative stress in the past few years. So here's some sources of oxidative stress. So basically, if we have, maybe you had a stressful year, and then you were living in a moldy building, maybe you were handling the mold okay, you were feeling okay, you had a stressful year, and then you got the flu or something, and all of a sudden you are exhausted, you are not recovering, it's been 6 months now and you still feel awful. And oh, then we check Epstein-Barr virus and it's active. Well, it wasn't just one thing that caused that, right? It was probably a combination. So again, we don't have a way of saying at this moment, this is what caused this. And usually we need to look at everything completely and holistically in your total oxidative stress load to start decreasing it and improving things. Now, why does this matter so much with Epstein-Barr virus? And here's the thing is that if you are taking antivirals or doing antiviral therapy, maybe you're doing IV vitamin C or ozone or valacyclovir or herbs, lauricidin, whatever you're doing. If you're doing that, you might be knocking that viral load down every time you do that. But if we haven't dealt with these things that cause oxidative stress, and your oxidative stress levels are still up here, as soon as you stop that therapy, that viral load is going to come back because there's a relationship between reactive oxygenation species and oxidative stress and Epstein-Barr virus. The reactive oxygenation species and Epstein-Barr virus reactivation amplify each other. So when you have that oxidative stress, we're making it susceptible so that Epstein-Barr virus can turn on. Now, once it turns on, guess what it does? It creates more oxidative stress, right? We talked about in that list where Epstein-Barr virus itself can create oxidative stress. So now we have a snowball effect. And the really key component here is that then once EBV is reactivated, like why does it make us so sick? Why do we feel so fatigued? Why is it associated with autoimmune conditions and cancers? Well, once that virus is reactivated, it turns on other pathways that are associated with chronic disease. Some of these pathways include the NF-kappa B pathway and the JAK-STAT pathway. So if you have an autoimmune condition and now you're looking back and you're like, I want to get checked and see, do I have Epstein-Barr virus in a reactive state or a high viral load? Is this contributing? Yes, we definitely want to handle that and address it. But we want to make sure that we don't just get stuck on EBV and that we address all the other things that could have triggered EBV to turn on in the first place. EBV is currently associated with 7 autoimmune conditions, and it's recently been linked more directly to multiple sclerosis, which we'll talk about more in upcoming shows. It's also linked to multiple cancers, and the reason, again, is because of this interaction. But when we see Epstein-Barr virus elevated or we see a high viral load, we have to remember that there's other things going on, that it wasn't just this virus that got us to this point, but the things that contributed to these oxidative stress levels. So how do we deal with the oxidative stress and combat that? There's things that we can change immediately by what we're deciding in our life with our diet, our routine, things that are causing mental, emotional stress in our life. There's things that are more in our control, and then there's things that are less in our control. We can also look more into things that we're putting on our skin when it comes to cosmetics, things that we're using for cleaning solutions. There's all sorts of ways that we can decrease that oxidative stress level. Now, if we have other things going on, if you have other things like environmental toxins, heavy metals, Lyme disease, parasites, things like that, you might need more help clearing those out and stopping that. And then the other thing that I like to do is add in antioxidants. So if Epstein-Barr virus is active, we know that your body is having more oxidative stress in general. And so there's antioxidants that we can use that directly target those pathways like TGF-beta and NF-kappa B that perpetuate that, and the JAK-STAT pathway. Introducing these antioxidants can not only be supporting you, but targeting those inflammatory pathways so that we're decreasing the likelihood that this chronic viral infection can turn into something more long-term or cause things like autoimmune conditions and cancers. And there are a lot of different antioxidants that can be used. The most important thing is to make sure that it is compliant and works well with whatever medications or other supplements you may be taking. And for a complete list of this, you can get my complete list in the show notes. But some of my top 2 ones are curcumin and glutathione. And the key with those as well is making sure that the body is able to absorb and utilize them. All right, we have talked about the real triggers of Epstein-Barr virus, and we have broken down oxidative stress to understand what that actually means and what actually causes it. So you might be feeling like you have more things to investigate. And oftentimes that's where this leads is when we really start looking at what is contributing to our health problems. There's more things that we need to uncover. Stay tuned for the next episode as we continue to discuss and break down these things. Be well.